Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the clinic director. In this video we're going to be looking at borderline personality disorder, the essential characteristics of it, a little bit about the history of where the condition came from, and some issues around being able to diagnose accurately and what might get in the way of an accurate diagnosis for this condition. This is also part of a series on looking at comorbid conditions with complex trauma and dissociation. So we'll be looking a little bit at the end around how this can get a bit complicated and some things about some future videos that we'll be doing on this subject. Now, borderline personality disorder is quite a difficult condition to be able to get your head around in many ways, and it's often misdiagnosed and it's often very quickly diagnosed. And this can be quite difficult for people to become accustomed to because it has been seen as one of those diagnoses that has a lot of stigma attached to it. i.e. there's a lot of negative attention surrounding what borderline personality disorder actually is, what it means, the impact of it, and what it can mean for people around the individual who's been diagnosed with that condition. So these can all be extremely difficult, so it's very important to be able to narrow stuff down and get things right in terms of whether we diagnose something like this or not. And diagnosis of this is often taking place within psychiatry, and not all psychiatrists use the right amount of time to be able to diagnose. Sometimes diagnoses are done very on the spot, and some are done extremely well and extremely accurately. And when a condition like borderline is diagnosed correctly, it can have enormous positive impact on that individual if they're given the correct access to treatment, help and support within which to sort of reduce the impact of this condition, which can be huge and in some cases life-threatening. So borderline is one of what's called the cluster B personality disorders. So it's also alongside things like antisocial and narcissism. So it's quite high end in terms of the impact of this on the individual and anyone around them. And the current thinking around borderline personality disorder is that it's kind of a mix of sort of genetic factors and adverse childhood incidents, i.e. childhood trauma. So there is some sort of interplay in the way that an individual is raised in childhood, the sort of the environmental factors around them, and then the impact of this potentially on the neurodevelopment of the brain in emerging childhood and then into adolescence, where a lot of the features are most commonly seen, and diagnosis starts arriving late into adolescence in early adulthood, and that's really the sort of the classic presentation timing of the diagnosis. There are some decent studies around this, and I'll link to various research articles and things like that as we go along in this video. The origin of borderline is kind of somewhere in the 1930s and the 1940s, and it was originally sort of around that time thought to be part of the schizophrenia spectrum of disorders. But it only really came into being with Carl Schneider in around sort of the 1960s and 70s, when it sort of became known as borderline personality disorder, and that became a condition in its own right. The prevalence rating in the general population is somewhere between kind of 0.5% and 2.5%, sort of 0.7 to 2.7%. It's higher in the outpatient population, which can get up to about 11 or 12%, and then up to sort of 22% in the inpatient general population, which is quite a high figure. And the prevalence of this is seen to be a little bit higher for women than it is for men. As I said before, the main features of this really merge in adolescence with things like sort of impulsive behaviours and mood instability, difficult with relationships, and some risky behaviour starting to take place. Now, while a lot of that is fairly common for adolescents, we have to think in terms of the intensity and frequency, duration of some of these symptoms. So this is seen as sort of well beyond what would be normal adolescent fluctuations in mood and stability and sense of self and all of those kind of things. We see sort of an emergence of what might be considered to be quite dangerous behaviours, so either aggression and violence towards people on the outside or dangerous towards the individual on the inside. And there can be some similarity at this stage with bipolar disorder in terms of that mood instability and that sort of fluctuation in mood and sense of things that are going on. So there are some quite depressive symptoms that can be within borderline personality disorder, and some quite impulsive sort of driven behaviours. But these are qualitatively different from that of bipolar disorder, and it's got to be very careful to make that distinction when doing the diagnosis. One of the most common things that is often seen is this sense that from the perspective of the person with borderline personality disorder, that other people are either all good or all bad. And there's this sort of black and white thinking that can take place within this condition. And there can be a high degree of dependency also. So people become very dependent on other people, and that can often break down if there's a sort of perception of being let down or rejected in any way, which can bring about enormously severe feelings of abandonment and rejection. And these can be hugely painful for the individual, and the impact, the ripple effect of this on other people can be very, very huge in terms of what can take place in terms of anger, aggression, or sort of vitriol in general that can take place, i.e. a sort of a lashing out as a result of that feeling of abandonment. And obviously within this, the risk to self, either in sort of low-key behaviours or extreme risk to sort of health and safety, this can take place within people with borderline. There's often sort of threats of this, and often there's signposting towards this, and it can take place in many, many different ways with very different degrees of severity, and it can be incredibly dangerous, and it can lead to loss of life in most extreme circumstances. In terms of the diagnostic criteria, if we look at the Diagnostic and Statistical Manual version 5, the DSM-5, there are 9 key characteristics, the features of borderline personality disorder that we're going to get into now. And in order to achieve a diagnosis of borderline personality disorder, there realistically needs to be at least 5 of these taking place within an individual. And these need to be observed for a significant amount of time. So this can't be in the context of, say, sort of alcohol or substance misuse or a head injury or another medical illness. All of these things have to be factored out in order to establish the diagnosis, because there can be some mimicking of these symptoms related to all those other factors. There also has to be a reasonable duration, so not in terms of the individual characteristics of it, because things can move, like in mood instability can come and go very quickly, but there has to be a long-standing pattern of this over the lifetime of that individual. So we're not seeing things like, there's a sudden change in mood or in impulsive behavior over a period of a week is going to get a diagnosis. That's not going to happen. It needs to be something that is seen to be emerging in adolescence and has taken place for years and years of that individual's life and has a long-standing impact on everyone around them. So what I'm going to do now is I'm just going to go into these 9 features one by one so that you can see exactly what they are. The first is a desire or a frantic effort to avoid real or imagined abandonment. So this is what we were talking about. There's this feeling of abandonment is so hard for that individual that they'll almost do anything to avoid it, and can really appeal to people to not abandon them, which can be quite intense and difficult for other people to take on. The second one is this sort of pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. And that's that kind of all good, all bad type thing, which is quite extreme. So it really does idolize people. And if that is sort of like if that individual then does one thing wrong or gets something wrong, or is there a perception of rejection or disappointment from that other person, then it can be characterized by this absolute swing in the other direction of this kind of intense hatred and almost sometimes a desire to harm or hurt that other individual because of the harm that's been caused to that self. There can be an identity disturbance, a marked and persistently unstable self-image or sense of self. So this is that fluctuating degree to which the person looks at themselves, considers themselves, and has any degree of self-image or self-esteem. This can really fluctuate between extreme feelings of sort of high belief in self and absolute destructive sense of self. And we can see there's a link here between, say, this and narcissistic personality disorder, because there is some overlap between the two in this characteristic. There needs to be an impulsivity in at least 2 areas that are potentially self-damaging. So we look for things like whether that could be eating, whether that could be sexual behavior, whether that could be substance use or spending. There's this high degree of impulsivity, not in one area. It has to be sort of mapped out a little bit broader than that. The 5th characteristic is about sort of recurrent suicidal behaviors, gestures, threats, or self-harming type behaviors. So this can be sort of signposted to other people, or it can be very, very intense and very secretive, but it has to be present within there. So this is one of the sort of the key characteristics that is often visibly observed and is in sometimes the thing that alerts services or emergency services to that individual's distress. 6th one is an affective instability due to a marked reactivity of mood. So this is really kind of mood shifts, so high-end anxiety, quite euphoric type symptoms can take place, often intense irritability, and these things can last for hours and sometimes days. where this sort of mood shift really does take over that individual's thinking, and there can be almost like a cognitive disturbance around it. There's this sort of focused, blinkered view about what's going on for that individual, and they kind of get stuck in this pattern of mood instability. The seventh one is a chronic feeling of emptiness. And this is where we see that sort of depressive symptoms that can have that sort of overlap between this and bipolar disorder. So within borderline personality disorder, there's often this sense of a black hole inside. There's something completely absent or missing. And often one of the things that we formulate is that a lot of the behaviours designed by that individual to sort of cope and manage in everyday life are about filling that hole, about sort of grabbing everything imaginable in the outside world in order to sort of bring it in and try and fill this hole, this emptiness that sits inside this person, which can be extremely distressing for them. The eighth is inappropriate intense anger or difficulty controlling anger. Often what can take place then is this real sort of intense displays of temper or irritability towards others. There can be violence, there can be aggression, there can be a lot of displays of anger and an inability to regulate that anger. So emotional regulation is one of the key characteristics that is often and commonly seen within the presentation of borderline personality disorder, where that individual might lose their temper or lose their ability to be able to sort of function in any given moment and can't regulate themselves back to that sort of equilibrium point. So when they become imbalanced in terms of their emotional state, they find it extremely difficult to regain that balance and get back to normal. Almost no matter what help is given, it's so intense and it feels absolutely overwhelming for that individual. And the last one is transient stress-related paranoid ideation or severe dissociative symptoms. And this is really when that person sort of loses that sense of the connection to the world. So their thoughts and their beliefs, their perceptions of what's going on either within themselves or around them can become extremely disturbed. And we move here into that sort of dissociative spectrum with this condition, whereas a lot of people with borderline personality disorder end up with dissociative symptoms. And we're going to look at some of those in the next video to really give a bit more of a deeper insight into this level of dissociation, because they're all the characteristics that we would ordinarily see within dissociation. So it's not like a different version, it's the same kind of thing, but it's played out within this sort of borderline personality disorder. And this is where things get interesting in terms of the series of videos that we're looking at and in terms of the reason for doing this. Is because there is this sort of the shared causality, this adverse childhood experiences, this traumatic childhood is present in both dissociation, present in both and in borderline personality disorder. So we see the same essential cause to this. We see neurodevelopmental factors taking place. There's a shift in the neurobiology of the system that's been seen in MRI scanning and PET scanning and things. So we know that this childhood trauma has a significant impact on the brain. Some people are diagnosed with borderline personality disorder, some people are diagnosed with dissociative disorder, and some people are diagnosed with both, amongst a load of other things. And what we need to do really is then sort of break down the connection between these two things. And there is some good articles on this. For example, Kraus-Utz in 2022 has written quite well about the links between borderline and dissociative symptoms, and there is a number of other things which are worth looking at. So we have an understanding that these two things can overlap in each other, they can both be present in each other, they can be diagnosed instead of each other, and sometimes the diagnosis might be incorrect. So given all of these 9 features of borderline personality disorder, the emergence in adolescence and in early adulthood, the likely cause within childhood trauma of some form or another, what we see is a very, very consistent pattern of the same things playing out across these two diagnostic groups. And we know in our clinical settings that a lot of people come to us with a diagnosis of borderline personality disorder, and then what happens is, as we sort of do more of a structured assessment of exactly what's going on, we see more dissociative phenomena taking place. And actually we sometimes think that the borderline diagnosis might be incorrect because, and as we'll be talking about in the next video, a lot of these characteristics of borderline are actually dissociative and they may not be borderline. They might not be personality things at all. They might be absolutely deeper into that dissociative spectrum, and sometimes the diagnosis needs to shift away from a personality disorder into a dissociative disorder. And that can be a very tricky thing to accomplish, and the structured assessment and the really detailed diagnostic criteria that's present within dissociation needs to be matched alongside the borderline in order to get this stuff right. And it's so important to get these things right, because we know that the treatment pathway relies on the correct diagnosis. If the diagnosis is not correct, the treatment is likely to head off in a direction that might not be helpful. And if a person is given all the right treatment, support and resources for borderline, and they are heavily dissociative, and that dissociation is not taken into account, a lot of the treatment simply might not be as effective as it should be. And this is a pattern that we're seeing across all of these comorbid conditions, and we have to really develop this understanding of dissociation in order to get this right. So I hope this video has been useful. It's been a bit of an overview really about what borderline personality disorder actually is, a little bit of where it's come from, the main 9 characteristics of the condition, some of the overlap then in terms of cause, and the systems of dissociation that can take place. So there's a lot going on that we need to factor in. So I hope this has been useful. Please like, share, subscribe, do all the usual things that are required, and we'll continue making videos, and please keep watching and leaving your comments. So in between now and the next video, please do take great care.